I'm John Chowning with Campbellsville University, host of Dialogue on Public Issues. Today, I'm very pleased to be interviewing a good friend and a person well known in our community, Ms. Jane Wheatley, the CEO of Taylor Regional Hospital. Jane, welcome.
Thank you. Thanks for inviting me.
Well, it's good to have you back on Dialogue on Public Issues. Share with our viewers, I think most everyone is familiar with Taylor Regional Hospital, but give us a brief history of the facility.
Okay, Taylor Regional Hospital is a 90-bed hospital located in Campbellsville, Kentucky. We actually moved into our current building in 1974, but the hospital became a hospital district in 1968. Prior to that time, the hospital was actually run by the sisters, and it was the old Rosary Hospital, which is now Gaines Recital Hall at Campbellsville University. And
Right.
So we took over and in 1974 built this building and moved into it and have been here ever since. Added many buildings onto it since that time, but we are still at the same location.
You know, it's interesting. You're on the board of trustees at CU. I've been on the board chairman and been an administrator for 20 plus years. We still have people who come to the campus and mention that they were born or remember their mother or someone being in the old Rosary Hospital. So it's still something of a landmark, even though it's a part of the Gaines Recital Hall and Gosser Fine Arts Building. That history is still there for many, many people. Tell us about, you mentioned 90 beds that are in the hospital. What are the scope of services, physician practices, and size of Taylor Regional Hospital today? Much larger than it was back in the mid to late 70s when I first met you and first visited Taylor County Hospital at that time.
Right. When I actually started at the facility in 1978, we had about 150 employees. Today, we are somewhere between 730 to 750, depending on PRNs and temporary positions. When the hospital first opened, it was a 60-bed hospital. Over the years, it has grown. Technology has changed to where we got to the point we are a 90-bed hospital. We're an acute care hospital, so we offer services in just about every area. The main areas we do not offer, we don't do any kind of spine surgery, and we don't do head trauma. But other than that, most things can be taken care of here. We do have cardiology. We are limited to the fact that we have a diagnostic cath lab, so we can do heart caths. However, stenting or open heart surgery is sent either to Louisville or Lexington for further treatment. But other than that, we are so fortunate to have such an array of physicians that offer just about every specialty out there. Urology is very strong at this hospital, general surgery, ENT, medical oncology, radiation oncology, strong internal medicine groups, strong family practice groups. So we are just very fortunate to have the big wide array of services that we can offer. Most recently, the last building we built was the rehab building across the road from the hospital. It houses our rehab department as well as the orthopedic practice. There are 2 orthopedic surgeons in that practice as well as a podiatrist. And we also offer aquatics. So that's a wonderful, popular modality for most physicians to offer for their patients.
Mm-hmm. And you have other locations now, not just the main hospital. Tell us about some of the other locations at, locally as well as in other communities.
Okay. We do have 2 locations in Columbia. We have some physicians that are going to Dr. Giles's clinic right as you travel into Columbia. We have a general surgeon, Dr. Bergen. We also have an OBGYN, Dr. Feast, that both go to that facility on a regular basis. Then we also have another location, and that is at Dr. Loy's clinic, and that is at the clinic right as you go to get onto the Parkway. It's a new facility. We offer X-ray and lab at that facility, as well as we have physicians that are going down weekly to treat patients. Dr. Feltner, who's the podiatrist, is down there on a regular basis. The orthopedic surgeons travel to that area, as does our peds practice.
And here in town, you also have some other sites, don't you? And not just in, you don't have to just go to the hospital.
Right.
Is my point.
Right. Well, first
Tell us about that.
I'll tell you about Lebanon first, because we have some sites
please.
there. And
Yes.
then I'll tell you about our newest facility that we have opened up. We do go to Lebanon as well. Urology is there on Fridays. We also ENT travels to Lebanon, as well as our medical oncologist. So they have space in Dr. George's building over at right in front of Springview Hospital, and they go on a regular basis. Our most recent off-campus venture is the Tiger Clinic. And while we have had the Tiger Clinic for a while over on campus, we have expanded it greatly. Starting this past Monday, Dr. Griffin Tucker has gone over there on a full-time basis. He is now there 5 days a week. He is seeing his patients that were currently with him over at IMA, and he also is taking new patients as well as taking care of the students on campus. He has been extremely busy the first 3 days. In fact, so much so that we're already talking about adding another staff member, and he's only been open 3 days. So we're very excited. We're excited for the students. I know as a grandparent of a student over there, I'm glad the facility's there. If my grandson gets sick, I want him to have the opportunity of someplace to go. And I'm sure a lot of parents, grandparents feel much better if they know that their child can go to see a doctor if they're sick.
And that is particularly important with COVID-19, and we'll get into the impact of COVID here in just a moment. But as a grandparent, and I have a granddaughter also beginning her freshman year at CU, so we as two grandparents of CU students, we're both happy that there is the Tiger Walkin Clinic on campus. You also have a walk-in clinic near the hospital. I think a lot of folks don't necessarily know about. Tell us about that and how easy it is for people to access it 7 days a week.
Okay. Our walk-in clinic is located right behind the pharmacy as you turn into the hospital. Right before you get to the hospital entrance, there is an entrance before that. There's a pharmacy that sits there on the corner. It is the building right behind that. You'll see a sign up on the building that says Sleep Center and Walk-in Clinic. They do use the center at night to do sleep studies, but during the day, they are open from 10 a.m. to 7 p.m. It is staffed with a nurse practitioner and a full staff. They are willing and able to see you. They do some testing there. If you need x-rays, they would send you over to the hospital, but you're just talking about walking across the driveway. But they are open 7 days a week. They are doing COVID testing. We have done a lot of COVID testing through that site, and anyone is welcome. If someone is having symptoms of COVID, they'll even come out to your car and test you in your car so you don't come into the building.
Very good. Very good. Now, a few months ago, the Cancer Center, a region of hospitals Cancer Center, announced a new affiliation with the Marquis Cancer Center at the University of Kentucky. Why was that decision made to affiliate with the Marquis Center, and what are the benefits of this new, relatively new relationship?
Well, we have been accredited by the Commission on Cancer for many years, but as you all know, as things change and the rules get more stringent, you need more partners. And one of the things we wanted to be able to do was to offer clinical trials for our patients. And if we didn't have an arrangement with someone, we weren't able on our own to offer those clinical trials for patients. So we did our research and we felt like Marquis was the best for our situation. They are world renowned. They have an array of services they offer, and we were already sending patients up to them anyway if they needed further treatment or they needed a treatment we did not offer here. So we worked with Marquis. They have been a great partner with us to help us get started on some clinical trials, to take our patients if the patients need to go up for further treatment, or sometimes somebody just wants a second opinion, which we understand completely. We're able to send them up, they get them in, get them back, and maybe set up what their treatment is in Lexington, but then they let us know so they don't have to travel back and forth for treatment. We can do it right here at home, and that way they don't have to travel. So it's going to be excuse me.
Marquis is the only nationally not recognized, but accredited center. It's a part of the 50 or so centers that are accredited by NIH or whatever the agency is. Is that correct?
That's correct. That's correct. They have been down to some of our meetings. They invite our physicians to sit in on their grand rounds on oncology. Dr. Lasano, our medical oncologist, talks to them very frequently. They talk about cases, they discuss treatment, and so does the radiation oncologist, Dr. Harden.
Taylor Regional also about a year ago purchased, I think invested about $2.5 million in the new Da Vinci robotic surgical system. Why was that an important innovation? Why was it necessary? And how has it changed the approach to many surgeries, and what kinds of surgeries are being done?
It's very interesting that you asked that question, because I met with the rep yesterday along with Dr. James Watkins, and we talked about the Da Vinci and how we had a slow period there for a while just because of COVID. A lot of the surgeries that are done on the robot are elective surgeries, and so during the COVID period, we were doing very few, but it's back robust, very robust. It is used by our urologists, Dr. Ben Angel and Dr. Meredith Angel. They are doing different urological procedures on the robot. And then it's very heavily used by Dr. James Watkins. He's a general surgeon. He is doing hernia repairs, gallbladders, abdominal wall reconstruction, just many, many surgeries that used to take an open incision or would take a longer time to recover. They've had great results. People have less pain. They're going home from the hospital quicker. They're recovering quicker from their surgery. So we are up. We've probably in total done about 150 surgeries on the robot. And that's taking out the 3 months, that we would have been much busier had we been able to use it during COVID. So they were down yesterday. We're talking about doing some testimonials and letting people talk about how it has made a difference for their surgery, especially in something like an abdominal wall reconstruction. It might take them being in the hospital a day or two, where previously they would have been in the hospital a week. So we're very excited about the technology. Our staff has embraced it. I'm very proud of the OR staff, and they were telling me yesterday that they are going to be, in the future, probably sending people here to learn from our physicians and to learn from our staff. So they have done a great job with this. And we also feel that going forward, as we're trying to recruit new physicians to the hospital, one's coming out of school now, especially in general surgery, OBGYN, urology, they have all been trained on robots. And that's how they're going to want to operate. And if we didn't have that technology, that they're going to choose to go somewhere else because they've spent 4 or 5 years in residency learning how to work on a robot. So for the future, it's going to be great for recruiting. For now, it's just great for our patients. We want to get the word out more to other communities that this service is available. And hopefully by doing some testimonials, we'll get that word out there.
It wasn't that long ago that you had to go to Lexington or Louisville to have a robotic surgery. And then more recently, Elizabethtown or comparable hospitals. So it puts Taylor Regional, it would seem to be in a very competitive posture to have this technology and instrument, so to speak, surgical ability available. And as you say, makes us more competitive as a regional facility.
Absolutely. And another one of our general surgeons is now training Dr. Bergen to become proficient on the robot as well. So I think people have been excited about what the technology offered. And as they've seen Dr. Watkins and Dr. Angel use it, it's something that like, oh, I like what this offers, and this is something I want to learn how to do as well.
And I might add, the hospital doesn't get extra money. compared to a regular surgery. It's not something that's a big money maker compared to other surgeries. It's just it's for the patient. It's a quicker way to heal and less invasive and so on. Right. Since March, we've all been faced with the impacts of COVID-19. What impact has it had on the hospital?
It's had a tremendous impact on the hospital from a lot of different reasons, for a lot of reasons. One, it's impacted the staff. We had to lay off staff in end of March, beginning in April, just because we couldn't offer the services and we didn't have the volume to support it. Thankfully, by the middle of June, we brought all of our employees back. So we have no one on layoff anymore. And thanks to the CARES Act, we were able to get some money from the government to help us during that time. But during that time, we saw surgeries. We were only doing emergency surgeries. So people that needed elective things, they were being put off. People stopped coming to the ER because of the fear, if I go to the ER and somebody's in the ER that has COVID, then I'm going to catch it. So we saw our volumes in the ER drop dramatically. We also saw inpatient admissions. I think people were not going to the doctor as much. They were trying to treat themselves at home, and then a lot of times they ended up sicker than they would have been if they had done routine. So we saw a big difference in what's going on in the hospital. Of course, the general public saw some big changes because before anybody could come to visit their loved one in the hospital, all of a sudden we have to close down. You're not allowed to come in and visit. And I know it caused some difficult times for people, and we felt really bad that people couldn't be with their loved ones. And but it was all for the protection of the patients, protection of the staff, and protection of the general public.
What all did you do to gear up for COVID? And then what services are you offering as a result related to COVID-19?
We had to do several things. We had to make what they call a negative pressure room in one of our ORs. So if we were doing a surgery on a COVID patient, that operation was being done in the negative pressure room. We went in and we took our first floor of the surgery center, made it into a COVID unit, so that the only patients that were in that unit were those patients that tested positive for COVID. Since that time, we have been fortunate in Campbellsville that we have not had a lot of inpatient COVID patients. So we have moved that COVID unit to where the old telemetry area was back on Wing 2. That is still the COVID unit. In fact, we have several patients in there now, but we have not had to use the big number that we thought we would have to do. I think the most we have had at any one time is 5 COVID patients positive. So we're very fortunate. We're not like the Louisvilles and Lexingtons and Bowling Greens that have been really hit hard. The one thing that probably is most important I need to point out is the physicians. Dr. Tom Rogers, Dr. James Watkins, Dr. Ben Angel, they were all on the forefront of making sure we did everything we needed to make sure the patients were safe and the staff was safe. Shannon Davis is our infection control director. She is working 7 days a week just to make sure that everything is in place, all that our employees have their PPE that they need, making sure we have 2 people that all they're doing is every day counting the PPE, giving it out to who needs it, but keeping control so that we didn't end up like some hospitals that then ended up having no PPE. As a result of that, we've had to hire some people to be our door screeners. If you come to Taylor Regional Hospital, you'll have your temperature taken. You'll be asked some questions. If you fail the questions, we'll ask you not to come in. If you fail the questions and we feel you're symptomatic, we're going to send you to get tested for COVID. So we have added on those positions, and we are just much more diligent in making sure that everybody is washing their hands, that they are staying social distance. You can't come into the hospital without a mask on. Also, if the employees, when they clock in, we have an electronic system now where they have to do a facial recognition. It takes their temperature. It prints out a badge that says you are fine to go out and work. And if you fail this, you're to go back out to your car and call the infection control nurse.
One of the things that you have been able to do is testing, COVID-19 testing. Tell us about that and some technology that has been somewhat unique for a facility like Taylor Regional to have access to.
Well, one thing I failed to mention a minute ago that I wanted to make sure I did, because Dr. Chowning was instrumental in helping us get a scrubber. We have several scrubbers that if there has been a patient that's been in a room with an infectious disease, or we think that they may have been infected, either COVID or something else, we put that piece of equipment into the room and it scrubs the air in the room. We also were fortunate, with the help of Dr. Chowning, to get a BD Max machine. And everybody was scrambling for those, and through his help, and he went all the way to the White House, we were able to secure that piece of equipment. That piece of equipment allows us to do tests on site, and then you get the results back in 3 to 4 hours. It is a wonderful piece of instrument. The only problem we've had is keeping up enough tests to keep it going. We've had to rely on sending tests out. We send them to Lexmark because we can get them back from there, in 24 to 36 hours, just because they can't keep us supplied with test kits. We have been informed that in the future they are retooling and we are going to be able to get more test kits. So we're hoping eventually everything will go to BD Max, or another technology they call, which is an APID machine, which we already have on site, and they do a more rapid test, kind of like a strep test, which is 15 to 20 minutes. But the problem is not the machines. The problem is getting the media to be able to run the equipment. And so we're just hoping that more test kits will become available, and then we will be able to rely just on the BD Max and the Abbott to take care of the COVID patients and to take care of those that are getting tested. Just to let you know where we are, we're probably getting close to 7,000 tests that we've already performed. We are doing some testing for different places that they're asking us to test every week for them. Some agencies here in town have asked us to do that. I know we've helped with CU in doing their students and their faculty. We're at Taylor County Schools, we're at Camelsville Schools. We have nurses at both, and they're doing COVID testing there. And then Dr. Griffin Tucker is going to be doing COVID testing on the campus at Tiger Clinic.
Well, again, we're very fortunate to have that capability. And as far as my role, it was a matter of making a few contacts in D.C. as far as opening some doors. And when you were told no, my saying to some folks that I know, no is not acceptable in this case. We need that technology for our people. And I'm thankful to have been able to help facilitate that. And the scrubber, I might recognize the congregation I pastor. Saloma Baptist Church made a very generous donation at the height of the coronavirus in honor of the healthcare workers in the community, and a particular thank you to those at Taylor Regional, and made a donation, and you suggested the donation going to help purchase toward the cost of an additional scrubber. So we were glad to do that. Now, a question related to COVID. I know that you're a part of KHA, active in the Kentucky Hospital Association and American Hospital Association, and talk daily to healthcare experts around the country and state. What are they saying about the long-term impacts of COVID-19? What do they think realistically about a vaccine and how soon it would be available, particularly to the public? And I know all this is speculation right now.
Well, they think it's going to probably be the first of the year. However, we're already gearing up to be ready. You have to have a freezer that is 80 degrees below zero to be able to store any kind of vaccine. So we're trying to get everything in place so that when that vaccine is available, we will be ready and able to give it to not only people in our communities, but people on the campus of the university, people in the schools. So we're looking forward to that. We want to make sure it's all been vetted and FDA approved, but hopefully by the first of the year, they can come out with something that'll be beneficial.
What are some of the more additional services that you have in mind and hope to offer in the future at Taylor Regional Hospital?
Well, we are interviewing a neurologist right now that is actually a graduate of the University of Kentucky. That's where he did his internship and he did his residency. So we're hoping to bring full-time neurology to this area. We think that'll be very beneficial. We also have several people from this community and from surrounding communities that we are supporting in school to come back and offer services in internal medicine, in family practice, and in different areas like that. So we're constantly looking for people that have ties back to this area, that are interested in coming back and providing health care. Dr. Milton Rogers has been great about telling us about students he's met on campus, and we're talking to them. Even if they're just starting their process, we know the time will go by fast, and we hope they'll come back to Campbellsville.
And I think there's a new pain management practice that's going to be offered through the auspices of the hospital. Is that correct?
That is correct. Commonwealth Pain, and they would be starting here, we hope, by the end of September, 1st of October. We're working on the final details on that. That would be a huge practice here in Campbellsville, and something our physicians have wanted for a long time. We also have done a Hep C clinic to help out those patients and to help them be able to get the medicine they need for their disease.
Jane, anything else that we have missed? We're down to about a minute left. Any additional comments that you would like to share with our audience?
The only thing I would like to say is to thank everyone. The people out here, the employees, have done a fantastic job. A lot of them have made a lot of personal sacrifices to be able to take care of patients, but we just appreciate the support that we get from the community, from the university, from the school systems to help us take care of patients, because that's our goal, is to make sure everybody gets the help that they need.
I might add, you have some great volunteers that work there and who raise money, your auxiliary that raises money, the van service that a lot of businesses in the community help support. Just a truly community-oriented enterprise and facility.
Right.
Jane Wheatley, CEO of Taylor Regional Hospital, thank you so much.
Thank you.
For being with us for Dialogue on Public Issues. God bless you and all the wonderful people at Taylor Regional Hospital. Give them our very best. This is John Chowning for Dialogue on Public Issues, thanking our audience for being with us once again.